Thank you, Mr. Chair. Very distinguished guest, and it's my pleasure to be here as the SCP ambassador from Bangladesh chapter. This is a very current hot issue globally. So vitamin D deficiency, current status, and its impact in clinical medicine, I will talk on this. 40-year-old lady complaining of aches and pains in limbs and difficulty in raising from the squat position in the washroom. She used to wear veil for 15 years. Her body weight is 49 kg and mildly anemic. No other positive finding was detected. Her husband is staying abroad. She has got two children. All routine examination was normal, so she was diagnosed as suffering from anxiety, depression, so treated with anxiolytic. There was no benefit. Her vitamin D level was found to be 11.1 nanogram per ml. 45-year-old gentleman is a corporate executive working in the AC room, never goes to the sun. He complains of fatigue, aches and pain all over the body for the last few months, non-diabetic, non-hypertensive. He did all the routine examination are normal, took some NSAID, flupentixol, melitrazine without benefit. And the vitamin D level was found to be 12.2 nanogram per ml. Correction of this low vitamin D status improved the condition dramatically. So, ladies and gentlemen, these two clinical vanities shows us that this was a wonderful examples of vitamin D deficiency in all sexes, in all disciplines of life, and every spheres of life. If you go through the website, you will see 100,000 and above cases, studies, researches, and so many things. So I will talk on many topics, but I will try to keep on my time. This is the sunbathing hormone, and actually Elmer and Adolph, they are the two main people. What is the form and source of vitamin D? And these are the two things. One is coming from the food, and that is the dietary one, and this is coming from the sun, or it is the ultraviolet B radiation. As you know this is very, very important, but the active form is 1,25-dihydroxycholecalciferol or calcitriol. That is the important issue. So the sources are food, only can give you 10 to 30% depending on the fortification. And this is totally not sufficient for human health. So sun exposure is the main issue. And 70 to 90% is being actually done from the sun. And from our skin, it starts. You know this, so I will not go into the detail. So the global, if you see the global situation, this is like this. Where it is not present, where there is sun, whereas there is no sun, less sunlight, every parts of the world, there is enormous number of cases. So almost 50% of the global population, they have been suffering from either insufficiency or deficiency. 1 billion people worldwide across of all age groups of vitamin D deficiency. So if we go, we can see that almost 40 to 100% of the US and European elderly men and women, they are suffering. Postmenopausal, almost 50%. Geriatric group, almost 56%. Infants in China, 42%. Adolescent in different age group, but mostly the older age group in Chinese, they are suffering almost 85%. Also, the Malay versus Chinese, there are some other relations, but we can say that vitamin D deficiency is a global burden for us. If you see, the gender-wise in India, the male-female is almost same. If you see in Bangladesh, the pregnant women are deficient almost 80%. If you see, also in India it is 84%. In Sri Lanka, you can see it is 40% ahead, but high prevalence for some factors. Some study recently, published in 2015, they are telling, you can see that almost deficiency in 57% and insufficiency in 31%. So if you combine this together, it is almost 80% plus. So these are, another one, in 2018 it is published from Sri Lanka. This is, in this place, there are 62% if you combine these two together. So in Bangladesh, there was one study, and it has been shown that almost 2/3 of the people, they do not know. They are not aware that sun exposure can give them, despite a lot of sun in my country, they are not aware that sun exposure can give vitamin D to them. So what are the factors that causes the hindrance? Only 20 to 30 minutes every day in the sun can make very good amount of vitamin D for a person, but we are not actually aware of it. These are the environmental factor. You can see during the summer and the winter, when the sun is declining, the ultraviolet ray also decreasing in the winter season. So these are very important issues. Smokes, that is the climate change and all other things. These are important patient-related factors. Clothing cover, use of sunblock, colored skin. So pigmented skin, the ultraviolet B ray cannot enter properly into the skin. Obesity is a very important issue, and when the elasticity of the skin is lost, that is the aging. Very important, it is the more you expose to sun, the more vitamin D will produce, but obviously we should do it very cautiously because excess exposure can do some harm and can cause skin cancer. So functions and association, as you know, this is the part. I am not taking any class over here, so this is just for the presentation's sake, a slide that how this metabolism of calcium, phosphate, and vitamin D is taking, parathormone is working like that. But if you check that the deficiency is less than 10 nanogram and 10 to 30, there is insufficiency, and 30 and above. And this causes, in one picture you can see sleep changes, fatigue, pale skin, recurrent infection, cough, cold, muscle strain, and so many things. We know about the bone health related to vitamin D. This is up-to-date conception of ours. But actually, this is just on the tip of the iceberg that we know vitamin D deficiency causes ricket in the children and osteomalacia in case of adult. But there are a lot of other diseases which we do not see, we do not know. The long list is there. So I will discuss on the clinical aspects of that. Some studies, they have says just the important point. This is a study in Korea. In low vitamin D, there is high risk of development of hypertension. This is very important. Vitamin D is associated with cerebrovascular diseases. And you can see it is cardiovascular hazards, and vitamin D is very much important. And this is also published in a journal in Circulation, 2008. It is almost established that vitamin D and diabetes. There are a lot of publications. I have mentioned only two. And it is very important that good supplementation possibly may prevent vitamin D deficiency. If can be corrected, cancer might have been prevented like that. This is another cohort study. There is risk of colorectal cancer in vitamin D deficiency. Also the same, prostate cancer, breast cancer. So a lot of cancers and vitamin D correlation, but it is not established that vitamin D deficiency causes cancer, but there is correlation between these two factors. Very common, vitamin D deficiency and respiratory tract infection. Many research has already been done. The next one, the tuberculosis, it is 4.5 times more likely when vitamin D deficiency is there, and there is a chance that people might develop tuberculosis in any parts, mostly in the pulmonary. Very important is pregnancy. Vitamin D and pregnancy is very much related, especially the preeclampsia mostly. And there are some other studies that cesarean section is also very important part. If there is vitamin D deficiency, cesarean section is needed for those people than that of the normal delivery. So you can see that it increased almost fivefold. The latest study in 2017, this is a double-blind, placebo-controlled, randomized controlled trial study. This is also saying the same story. Vitamin D and infertility. This is also established nowadays, and there are publications. And also the fetal growth. If there is deficiency of vitamin D of the mother, the fetal growth will be lower. And obviously, this is published in the journal well ahead, but nowadays they are also working on it again. Low birth weight is another issue. Bronchial asthma from the childhood is related to the vitamin D deficiency. Very important is vitamin D deficiency in the brain. So there are so many things in the study, but one important issue is the vitamin D deficiency with Alzheimer's. They are telling about dementia, depression, and so many things, and also the seasonal affective disorder. If I go through all, the important issue is total. If you see, the disease burden is huge in number. The lower the vitamin D, the more the disease that is shown in the slide. And who will suffer from what, it is not predicted. But you can assume. What experts says about, so everybody should be screening for vitamin D. We are here in this hall. We should do our vitamin D? Obviously not. This is not supported that everybody should be screened for vitamin D. When there is symptom, only then you will go for this. So whom you will screen? The long list. But at least we should remember that there are the people who are homebound, the people who are at menopause. Nowadays, you have seen in the textbook of Davidson that rheumatoid arthritis, the people are suffering from, they have the low vitamin D deficiency, vitamin D. So some of this list will fit, and then you think. And the person who are getting some drugs that can cause. So this is very important. I will go a little bit rapid because time is important. You can see that this is called deficient. If it is 0 to 11, then 11 to 20, and 20 to 30 and above, you can see that this is important and for your knowledge and for detection of a patient. The optimal, you know that some people make it a nanomole. If you divide nanomole by 2.5, you will get the nanogram. So it is very easy to calculate. They are the high-risk people, know the elderly people, and obese. I told it before. Regarding management, few words. Some people think that taking vitamin D supplement might develop some toxicity. This is erroneous. No, never. Usually it does not occur in a therapeutic dose. Never it occurs. So sometimes people they think about that fat-soluble vitamin, if I take for a long time, I might develop toxicity. So this is less chance. It has been established by doing some lot of researches that long time high dose, that is a different issue. But if you take the judicious dose, there will be no problem. There are some advice. Facts about the vitamin D supplementation. One should be very careful. You should know the nature and severity of the disease. The natural, you know, that you can go to the sun for 20 minutes, 30 minutes, and you can prevent it. That is the most important issue. Sri Lanka has got a lot of sun, so there should not be vitamin D deficiency in Sri Lanka, in Bangladesh. But in UK, many months and days there is no sun. So when there is sun, in USA and UK, the people run to the sea beach to get the sun. That is the important thing that we should keep in mind. And 10 to 15 minutes, 2 to 3 times in a week, that's the most important thing that you can do. For supplementation, in pregnancy, you must give the supplementation properly. That is a very important issue because there is one saying, worrying about vitamin D toxicity is like worrying about drowning when you are dying of thirst. This is from John Cannell. We have to understand the main issue. In conclusion, Mr. Chairman, I have to say that global health, this is a global health problem, commoner than what we are thinking about. So we have to promote the awareness about the vitamin D. Enough sun exposure is needed. Adequate intake of fortified food in the diet, and supplementation is another right choice. Actually, yesterday was the vitamin D day. Today is the 3rd November, but the 2nd November is the vitamin D day. So I'm talking the topic on the eve of the vitamin D day. So you educate your patient, and you participate in this program. What we can do, we learn more about vitamin D and educate and participate our patient. Do yourself a favor, have more vitamin D and enjoy a delightful life. Thank you very much for your patient sharing. Thank you.